हमारे एक रिलेटिव है यहाँ दुल्लापल्ली के पास रहते हैं, वो कैंसर पेशेंट नहीं है, लेकिन वो हालत मीडियम है, लोअर मीडियम है। तो व्हेन दे वो 3 times ही फेल फ्रॉम द बेड, बाय 12 दे स्लेप्ट, हस्बैंड वाइफ है, उनका छोटा भाई है। तो वो सुबह जब व्हेन दे इन द मॉर्निंग दे गॉट अप, दे फाउंड दैट ही इज लाइंग ऑन द फ्लोर, ज़मीन पे पड़ा हुआ है। तो उसको वो लेकर के गए हॉस्पिटल में, तो वो बोले 50,000 डेली का चार्ज लगेगा। विद ए हम्बल रिक्वेस्ट, डोंट माइंड, आई कंप्लीटेड माई 70। आज के दिन हॉस्पिटल और एजुकेशन सबसे बड़ा लूट का अड्डा है साहब। व्हेन वी वर चाइल्ड 10 पैसे में मेडिसिन मिलता था गाँव में साहब, और आजकल तो लूट का सबसे बड़ा, वी कैन नॉट बार्गेन विद देम। इवन व्हेन वी गो टू बाई ब्रिंजोल, बैंगन लेना है तो आधा किलो हम बोलते हैं 12 रुपये नहीं 10 रुपये करो।
For example, we are there in MNJ में पूरा ट्रीटमेंट मिलता है, पेट स्कैन है, रोबोटिक सर्जरी है, हाई एंड रेडिएशन मशीन्स है, बोन मैरो ट्रांसप्लांट है। फिर पेशेंट्स गो टू प्राइवेट हॉस्पिटल्स, get all the money exhausted, and the last stage they come to us. That is the main problem. See, if you look at the hospital, how they charge, that nobody can control. Even the government also cannot control because a lot of issues are involved. But why can't the patients come to government hospitals and get treatment? Why do you go to a private hospital? Patient has injury, उनको चोट लगा, वो गवर्नमेंट हॉस्पिटल जाना है, उस्मानिया में है, गांधी में है, उधर जाने तो नो इमरजेंसी में कोई क्यों नहीं इमरजेंसी में क्यों नहीं होता है ना। इमरजेंसी 24 आवर्स ओपन रहता है, इमीडिएट अटेंशन मिलता है। रूटीन पेशेंट को क्यों होता है, क्यों लार्ज क्यों होता है? ट्रीटमेंट सस्ता है, दैट्स वाई लार्ज क्यूज आर देयर। ट्रीटमेंट इज रिलायबल, गुड ट्रीटमेंट, free treatment, that's why large queues are there. So see what happens in private hospitals and how they run and how to control them, that is a totally different topic. That is not in our scope. Yeah.
Sir, question here, this is a multifold question. Is cancer contagious? If yes, what type of cancers are contagious, and where and how these can be transmitted or spread to others? And the third question is, what are the preventive measures to stop it?
First, cancer is not contagious. It will not spread from the already formed cancer, will not spread from one person to other person. But here there are some viral infections that can lead to cancer. For example, the liver cancer caused by hepatitis B, hepatitis C infection. This viral infection can spread to person, but not the liver cancer. So another thing is cervical cancer. That also can be most of them are caused by the viral infections called human papillomavirus. And there are vaccines against human papillomavirus. So the virus can spread from person to person. These viruses can cause cancers in some people, may not cause cancers in others. So the virus can spread, but cancer is not contagious. It won't spread from person to person.
Sir, at what age we should take those vaccines to prevent?
The standard is between 8 years to 15 years. 8 years to 15 years, because at that time, the maturity of that cervical organ, it is not there. And any infection occurs at that time, it can enter body easily and cause cancers. So ideal time is between 8 and 15 years as far as HPV vaccine is concerned.
Thank you, sir. Sir, you're saying something, please.
Is there any timetable? Is there any timetable from infant stage to the age 100 years? The vaccination or any precaution, what are the methods that are to be taken care for prevention or?
We are talking about only vaccine. Yes. We are talking about vaccines. Yes. Hepatitis B vaccine is given at the time of birth itself, day 1 itself. And then at 1 and 6 months. If you completed hepatitis B vaccine, see, first thing is, there is no vaccine that can prevent cancer. That is the starting point. There is no vaccine that can prevent cancer. We are preventing some viral infections. thereby reducing the rate of cancers. These vaccines are given to prevent infection. And we know some of the cancers are caused by these viruses. By preventing this viral infection, we will reduce the rate of cancer. So when it comes to age, hepatitis B vaccine given at birth, and this cervical cancer preventing viral infections. They can begin ideally between 8 and 15 years, 2 doses. And then some of them are promoting up to 25 years. You have to give 15 to 25 years, 3 doses. And after 25 years, in India, there is no evidence. In the West, in US, they are giving up to 50 years also with no proven benefit. Yes.
What is the cost of immunization?
The Cervarix is vaccine available in India now is costing around 230-300 rupees in government sector. 300 rupees in government sector. Yes. They are supplying to government organizations at that price. Yes.
Sir, may I ask you this question?
Yeah.
With due respect to you,
Yeah.
Dr. Sir. Sir, what is the basic diagnostic protocol for any this one? Because PET you have excluded.
I am not excluded. What I said is, don't do PET-CT to know a person has a cancer or not. Okay. Suppose I have a doubt, I have a cancer or not, I should not get PET-CT done for that purpose. I have not said PET-CT is not useful. Take it in proper context. The context is, we are trying to detect cancer early. Patient has no symptoms. We want to screen and find out whether cancer is there or not. Don't do PET-CT for that reason. I never said don't do PET-CT at all.
Okay.
PET-CT is, see, every investigation has its own place. We should know how to use it. It is like any test. Has very good if it is used properly. So what is good is good for that particular indication. You misuse it, unnecessarily use it, lot of problems will come. For example, we know many people, suppose one person wanted to go abroad, he wants to know before going abroad whether there is a cancer or not. He got a PET scan done, there are some spots, he underwent 100 tests, finally nothing is there. So what happens here? It is not indicated. See, that's what I am trying to tell. Don't do unnecessarily unindicated. If it is indicated, yes. Like a particular stage of cancer, particular stage and particular type, we do PET scan, we can detect metastasis. But a lot of limitations. The sensitivity, specificity is around 50 to 60% only. There are some cancers where PET scan cannot pick up metastasis. And in some cancers, what is happening, patient has, we have hundreds of examples. Patient has some other problem somewhere, but PET scan is positive because any infection, PET scan can be positive. That is very important. Tuberculosis, PET scan is positive. Our population has around 40% tuberculin positive population. If you look at Indian population, at least 40% of us had tuberculosis, which is not manifest. It has occurred, disappeared, but you do a PET scan, something will come positive in the lung. Then they say it is metastasis, not curable, go on giving chemotherapy. So this is all unfortunate. So each test should be done in the proper context and should be in proper clinical situation. The person who is ordering the test should understand the limitations and also proper context. For example, patient has a stage 1 very early cancer, very low grade cancer, PET scan is showing some metastasis, don't jump and treat. You find out what is the cause. So that is unfortunately, even from our side, doctor side also, a lot of things are happening. But I want to make you aware that now the time is, people read and come. Many times they read and come. They ask a lot of questions. It is your right to ask questions, get proper answers. If you are not satisfied by the answer, you can go for a second opinion. That is what is very important. That is also awareness. Yes.